2024, and this is a Protect Our Province BC live briefing on launching a campaign for clean air in schools and for Safe September. I am Dr. Susan Coe, a family physician working in Richmond, BC for 31 years. I'm a clinical associate professor at UBC and a member of Protect Our Province BC. Protect Our Province BC is a nonprofit grassroots organization consisting of doctors, nurses, healthcare scientists, community advocates striving to keep the people of British Columbia safe by sharing accurate scientific information about COVID-19. We also advocate for the BC government to do more to protect the health and prevent chronic disease and disability for everyone who calls BC home, starting with the most vulnerable among us. We begin respectfully acknowledging that we are broadcasting from the traditional, ancestral, and unceded territory of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. We are grateful to the Indigenous peoples who have cared for these lands since time immemorial. As settlers, we commit to our utmost to uphold the Truth and Reconciliation Commission and work towards the 94 calls to action. Today, we are very happy to join us Dr. Susie Ma, Luc Latulip, and Jacqueline Ferrer. Susie Ma is a COPE, Coalition for Progressive Electors Vancouver School Board trustee. She's a recently retired Vancouver teacher with 35 years of experience and is currently in the middle of serving her 4-year term in office. Luc Latulip is a grandfather to a 6-year-old going to grade 2 in Vancouver this fall. He is a member of the Van Deepak Health and Safety Working Group, focusing on improving indoor air quality in schools to prevent COVID, as well as a member of Do No Harm BC. Luc is an animation director with over 30 years experience. Jacqueline Ferrer is a researcher, disability, rare disease, and education advocate, mom of 3, and a member of Protect Our Province BC. This summer, one of the largest waves of COVID since Omicron occurred in North America due primarily to the new KP.3 variant. In Canada, currently 1 in 32 people are infected with COVID, according to University of Toronto professor and infectious disease researcher Dr. Tara Moriarty. Dr. Moriarty's data also found that we're having one of the highest numbers of excess or unaccounted deaths in Canada since the winter of 2022, with 1,100 excessive deaths per week this summer. With fewer than 20% of COVID deaths being reported publicly, there is a high likelihood that COVID is the cause of these unaccounted excessive deaths. This means across Canada, COVID is still the number 1 or 2 cause of death. This is proving once again that COVID is not a seasonal virus and that the pandemic is not over. Meanwhile, in Australia, has had a tough winter with their hospitals and emergency departments overrun with COVID and influenza. This is worrisome because the state of Australia's winter season is often a good predictor of the following winter in Canada. Despite the surge of COVID, we are entering the 5th school year during this pandemic with once again absolutely no COVID protections in BC. Gone are mandatory masks and requirements to isolate at home when sick with COVID. PCR COVID testing is restricted to patients who are admitted to hospital. COVID immunization rates are abysmally low, with less than 20% of adults and only 1.9% of children under 4, 4% of children ages 5 to 11, and 6.1% of children between 12 and 17 fully immunized with COVID vaccine. COVID has been downplayed by the provincial health authorities, so it repeatedly told the public that COVID is no more than a cold. And on July 5th, the state of emergency for COVID was removed by BC's provincial health officer. Jacqueline, thank you for joining us today.
Thanks for having me.
I've heard some parents express their concerns about their children returning to school with the current state of COVID this fall. What are your thoughts?
My concerns remain the same as they have for the past 4 years. This is our 5th unsafe September, as we call it. We're sending kids into schools without any layers of protection, and the most vulnerable children are the ones who continue to bear the costs of this negligence.
Jacqueline, how do you think families with vulnerable children and other family members are faring right now, and how have your children been faring?
We're not okay. We shouldn't have to disclose personal information to try to encourage people to care or understand, but unfortunately, I feel forced to. So our personal situation. My kids and I all have ADHD and we share a rare disease. One of my children also has 2 additional rare diseases, one of which is so rare that at the time of their diagnosis, they were one of only 10 people on the entire planet that were identified with it. They are also autistic. Each of these diagnoses on their own makes them higher risk, and when combined, compounds their risks, and they're not protected at all in their school. And when we attempt to put in place our own layers of protection, we are blamed by the school for a supposed lack of educational progress, without any acknowledgement as to the school and district's role in the decisions that we're forced to make. As for how our kids are faring, whereas prior to the start of the pandemic, they were actively a part of their school community, they are now essentially ghosts of their former selves. They attend classes only, no extracurriculars. We hear a lot of talk about community in our schools, but in reality, community exists only for some people. Our kids ask why their teachers won't protect them. They are bullied by other kids in their classes, having their masks pulled off, screamed in their faces about the pandemic being over. And not all of that is on the school, but when there's not one adult in their school modeling inclusive behavior or educating the other kids about safety and inclusion, it's easier for these anti-scientific and bullying attitudes to blossom. They've also faced comments such as, I can't hear you with that thing on your face. And none of this is okay, and it definitely doesn't reflect community.
I'm so sorry to hear this is happening to you and your kids, Jacqueline, but thank you so much for sharing that with us. Jacqueline, why is COVID safety and rules so vital to our community?
Well, since 2020, institutions like Princeton and studies from around the world have shown that when COVID hits schools, it spreads back into their communities like wildfire. Heat maps have consistently shown that infections start in younger populations and spread upward to older populations. CIDRAP most recently, in the spring of 2023, showed that 70% of US households saw COVID spread start with a child. Additionally, CIDRAP has shown that 40% of children are still infectious after their symptoms appear to resolve. So if we're not mitigating at a school level using all available tools, and we are relying solely on symptoms to guide our response, schools are going to continue fueling these surges.
As a family doctor, I saw many families with children who seemed to be continuously sick during the school year last year. How do you think this is impacting children?
So we keep hearing about kids and learning loss, which is really an invented concept. Without dealing with the elephant in the room, if kids are sick and missing school, or even sick and attending school, they're not going to be able to work to their full abilities. Not only are kids getting sick with COVID repeatedly, and COVID is damaging their brains, it's also weakening their immune system. So they're getting sick with other viruses, causing them to be sick more often than in the before times, and they're more likely to fall behind. Additionally, and this is something all three of our kids faced in the last academic year, especially, teachers are sick and they are missing school, some for really long periods of time. And how we see that impacting kids is with the lack of teaching continuity, the lack of rapport with different teachers or even non-teachers cycling in and out of the classroom. And in the case of immersion programs, a lack of immersion. So for example, no French teachers to cover French classes. And perhaps most egregiously, we see learning support teachers pulled to cover classrooms so that the disabled students whom they are meant to support go without. This happened more than a month straight last year at our kids' elementary school. And my children were two of the kids impacted by this lack of LST support.
Luke, thank you very much for joining us. You have a grandchild currently still in school. Besides the things that Jacqueline has mentioned, what additional concerns do you have?
Thanks, Susan, and thanks, Jacqueline. Yeah, I echo everything that Jacqueline just said. Another big challenge we've been talking about and seeing is the extremely low COVID vaccination rates around the province. I think it's about 34% or so for adults, but it's especially low around kids. It's way too low. I think we were talking the other day, it's about 6 to 10% in teens and well below 5% in younger kids. Accessibility for vaccines has been terrible. They have not been, it hasn't been done equitably. They haven't always been easy to get, nor have boosters been timely. A lot of parents who have more than one kid have had trouble, have encountered having multiple different vaccine appointments at different pharmacies. That makes no sense. Recently, Dr. Bonnie Henry announced on August 19th that we should vaccinate kids because of the upcoming respiratory season. That's great, but as usual, it was very laissez-faire. It was very indifferent. just saying, hey, you should get a vaccine is not the same thing as an active vaccination program that is set up to vaccinate as many kids as possible before school starts, rather than just say, it's up to you. It's too little, too late. Just before we started this call, I told you that I tested positive today. So there's so much too little, too late happening. It's incredible. I managed to stave it off for 4.5 years, but today it got me. We're likely, apparently, at the peak or near the peak of the ninth wave, which experts say may be bigger than Omicron. Sure, fewer deaths, but just as many, if not more, infections. And what's that going to mean in the long term?
Luke, I'm so sorry to hear what's happened to you, and I totally agree. One of the other issues is that Health Canada is not going to be releasing the COVID vaccines, I've heard, until October. But in the US, it's available this week, I believe. Luke, as a part of the Van DPAC Health and Safety Working Group, what are you pushing for?
Right. So I've been with DPAC, Vancouver District Parents Advisory Council. Sorry, I always get it wrong. And a few years ago, they formed a number of working groups, and I joined the Health and Safety Committee. Our biggest goal is simple, and it's clean air in schools. And not just schools in the Vancouver district, but across BC. This really needs to be implemented province-wide. It needs to be national. But a few good things happened this year. In May 31st of 2024, this year, new guidance was put forth by Vancouver Coastal Health and Fraser Health called Ventilation and Indoor Air Quality in Schools and Childcare Facilities. DPAC actually worked quite closely with Vancouver Coastal Health in crafting this. It's based on and recommends the newest ASHRAE 241 guidelines for ventilation, not just upgrading HVAC systems, but also the addition of air cleaners and monitoring CO2 levels in classrooms. Hopefully you can include the link to it in the notes for the show, because it's actually a very good document. Barring one or two things, it's the best guidance we've seen so far. The other thing that came out recently on August 9th was that the Ministry of Education and Childcare also issued new guidance for clean air and ventilation in schools, called, it's very dry, Guidance for HVAC Systems, which they say at the opening of the document is intended to provide considerations to school districts with regards to improving heating, ventilation, air conditioning, HVAC system performance. Both of these new documents are extremely important. They show us that policymakers, while they have been telling us that COVID is mild for 4 years and kids don't drive transmission, suddenly have new guidance for clean air in schools. So they knew they were wrong. They'll never admit it publicly, but we can work with this to help further the goals of clean air in school.
Luke, could you tell us some specifics about what they're recommending, what the health authorities have recommended clean air in schools?
They're definitely talking about how CO2 buildup is bad for learning. It's bad for your concentration. It's bad for your health. So they're talking about not just monitoring CO2 levels, but lowering them, which is great. It's important. They also finally talk openly about air cleaners in schools, without any barriers against doing so, as we've seen in the past. The only barriers that would exist would be in the individual schools themselves. So as many parents who've tried to get air cleaners in their kids' school, that's what started me on this journey in the first place, is I wanted to get an air cleaner. I wanted to get a Corsi Rosenthal box that's still sitting here in my office that I made for my grandkids' first day in kindergarten. Still haven't been able to get it in the school. So that's up to the school itself, that's up to the principal, that's up to the PACs, the parents. That push can happen, but it has to come at that level, because there is no timeline for either one of these are just guidances. They're great, but they're not saying, and we're going to implement this by such a date.
Mm-hmm. I totally agree. As a member of the Vancouver DPAC and Safety Working Group, can you tell us what your group thinks about these recommendations?
These recommendations are great. The one by Vancouver Coastal Health we think is much better than the one by the ministry. The ministry, we have a number of people in our group that are microbiologists, they're engineers, doctors, researchers, and they felt that the one by the ministry was a little bit off. Like in some places, they both of them talk about the ASHRAE 241 standard, which is fantastic. Thank goodness they're talking about that, and that's being brought in. But the one by the ministry tended to interpret it a little bit. Better people than me can talk about that. Engineers would be the one to really talk about that. But I think it's fair and uncontroversial to say that it's generally agreed upon now that we need to improve indoor air. In schools, yes, but everywhere. Health authorities have updated their guidance, and even the CDC last week encouraged air cleaners and setting HVAC intakes to be set to, rather than auto, to high, to get as much fresh air brought in. The plan should be air cleaners in classes now. We've had a few parents in our groups who've managed to get air cleaners in their schools. We know from being able to measure the air in these classrooms, which is being done. We know that we've seen results. We've seen fewer sick kids, fewer sick teachers. The bottom line is we all know schools, by their very nature, are significant vectors for community transmission of any infectious airborne diseases. I mean, that's the first cave kid in cave school could have told us that. We know that schools have been responsible for roughly 70% of COVID transmissions in the home since the beginning of the pandemic. We also know, just again, by the nature of classrooms, when we put 20, 30 or more kids in a room for 6 hours, close the windows, and one of those kids happens to be sick, it gets passed around. And this isn't blaming the kids. The kids are not to blame in this at all. We are supposed to be making this we're supposed to be making schools as safe as possible for kids. And anybody who is in there, the adults who work in there too. Clean air in schools will give us a huge edge in reducing that spread, reducing sickness in children and their families and school workers, reducing long-term health, long-term illness and death, and it will be good for everyone. There are no downsides to clean air. We know this. So our health and safety working group is going to continue working on this. We're going to keep pushing this forward. We're going to keep building these relationships with policymakers and communities to see this happen. We are hoping that this year we will be able to get a lot more accomplished. We no longer have, we have these two guidances that prevent a school from saying, no, you can't put air cleaners in schools. So if there are enough parents and teachers and enough community members who are willing to get behind this, we can do that. We are also going to be at the upcoming Clean Air Festival in a couple of weeks, and we'll be handing out our first comic there. It's a little booklet on clean air, and hopefully we'll be able to put a link to that later on in the show notes.
That sounds really fantastic, Luke. Thank you for all the work you've been doing with the Van DPEC committee. That's wonderful. You mentioned that you, and I know many stories of parents trying to donate HEPA filters and Sierra boxes to their children's schools during the last 4 years of this pandemic, but they've been rebuffed by their school administrators or their school boards. Can you tell us a little bit more about experiences that you and your fellow DPAC members have had with this?
Yeah, there's a lot of levels. Anybody with kids, I don't have kids. I went from being my grandkid is my husband's daughter's kid, so I didn't have to raise any kids. I just went to the fun grandparent stage. I had no idea how complicated it was, how complicated schools were. I had no idea how bad it had gotten over the years, where parents have to constantly run these fundraisers just to make enough money to get basics for the schools. I had no idea that some of the schools didn't have proper drinking water. I had assumed that all the schools had been up to speed on what do you call it, earthquake proofing the schools. I'm stunned at how crappy the schools are becoming or have been allowed to become in communities that really care about their schools. Like, I've been to a few events at my granddaughter's school, and I don't see anybody there who's unhappy about the community that they've built in their schools. Um, so that's what's going to help us. Building those communities is what's going to help us. But the experience we've had, as I mentioned earlier, trying to get one CR box in a classroom, couldn't get other parents on the PAC interested. The school principal wasn't interested, so it gets dropped. The places that have been able to get them in, sometimes legitimate complaints about the noise that some of these units make. So a lot of work has been done over the past year or two, studying what makes a quieter Corsi Rosenthal box. And we have a lot of that information now, and it's all about how we use it to make it happen.
Thanks very much, Luke. Jacqueline, as a parent, what do you think about the new recommendations for clean air in schools proposed by Vancouver Coastal Health and Fraser Health? And do you think this is enough to protect vulnerable students and their families?
I think the recommendations are a really good start for parents who are advocating for clean air in their kids' classrooms, but I don't think they're enough to protect kids on their own. A key factor that is always left out of the discussion is masking, which is such an important form of source control. Constantly disregarded is the overcrowding in classrooms. Ventilation and filtration are so important, but they aren't source control and they won't prevent near-field transmission. And when kids are sitting face to face in packed classrooms for 6 hours a day, breathing into each other's faces, they aren't going to be enough, especially when we aren't using other public health tools, such as test, trace, isolate with support to try to prevent the virus from getting into schools in the first place.
Thank you very much, Jacqueline. Now we move to Susie Ma, our BSB school trustee. So Susie, thank you very much again for coming on today. What do you think about the new health authority recommendation of ventilation and indoor air quality in schools?
Well, first of all, thank you very much for inviting me to be part of this podcast. I was actually quite surprised to hear about the new health authority recommendations because as a trustee, this information was not shared with me. So when you contacted me and shared the document, which I'm looking at right now, it was last updated on May 31st of this year. I have not seen it, and so I was quite surprised about this. And in terms of looking at these recommendations, it's a no-brainer for me. When the air is not clean, children cannot learn properly. And Luke talked a little bit about, the brain fog, the dizziness, falling asleep in class, just, it's just not really healthy. And I mean, all of us have been in situations, in meetings or in other places where it's been really crowded and it's really stuffy and it's hard to concentrate. So if you think about children who are in a classroom for, 4 or 5 hours every day in an enclosed space, and not just children, but workers, both teachers and support staff, if they're working in environments where it's very stuffy and the air is not clean, it affects, their performance, not only academically, but physically. And we all know that children's brains are maturing, they're growing, their bodies are growing, and they need air, they need clean air. We always say to kids, go out there and play, it's great for you, right? And so here we are, we have health authorities that are recommending certain things to make sure that ventilation and air is clean in schools, and yet as a trustee, I'm quite surprised that I didn't know about this.
Yeah, thank you very much for sharing that with us. Now, do you think that the other school board trustees are aware of these new recommendations for clean air?
Certainly none of my fellow trustees. So I'm one of 9. I'm the VSB trustee. I have not heard from any of the other 8 whether or not they've heard of these new recommendations. And certainly in terms of discussions, both at the board level and committee levels, we have had sort of briefings on ventilation And there have been questions that have been brought up by different union groups and also by our district parent advisory committee representative that's on our facilities and planning committee. So in the past, we've, like right up till recently, we've had sort of questions about that, but there has not been any discussion about these new set of recommendations.
I know you can't say this for sure, but based on your discussions with the other Vancouver School Board trustees, do you think they would look at these guidelines favorably?
I would say that, we have been elected to look after the education of children in our district. And so I would hope that my fellow trustees in their journeys and their travels would be exposed to this, and hopefully through either going to the Clean Air Festival or going through you, Susan, sending your emails to the board. Hopefully those will be shared with the other trustees, and the trustees will take notice of it, and we can have those discussions in our committees. I'm not sure, but they should be interested. I mean, it's for the health and welfare and educational healthiness for children, and so trustees should be interested and engaged.
That sounds very hopeful. Thank you, Susie. Now, what do you think parents, the Vancouver DPAC and other DPACs, can do to advocate for clean air in schools?
Well, I'd like to thank the parents who continue to, be so passionate about this issue to try to make the classrooms safer for our students and for our employees. I think that the parents can do several things. I sort of made a list. And so I would say that first and foremost, individual parents should raise their concerns at the school level through their administrator, and also go to their PAC representative at the school and go to the PAC meeting and bring it up as an issue. The second thing they could do is that school PACs can talk to their school union stewards. So they're usually, for every school, there's going to be a staff representative that represents the teachers union. There's going to be support staff union stewards at the school. And I would say that if there's an issue about, clean air and about any sort of communicable disease, they should feel, that they can go and talk to those union stewards and garner their support as well on raising that issue. I mean, we need to work on this together. It's not an individualized approach. And if we can coordinate our efforts, the more the better. So the third thing that we could do is school PACs should raise their concerns, of course, with their district PACs. And I know that this is happening because Luke is a representative on the Vancouver DPAC, but I'm sure that other school districts could do the same. And they should work with other like-minded PACs, across the province, and then lobby at the provincial level, because there's a BCC PAC as well that represents all the PACs. And there are representatives, and they have an executive board. And again, these are things that they can lobby for at the provincial level. I also would hold the provincial government feet to the fire. These are recommendations that have come out of Coastal and Fraser Health. These are under the purview of the province with their health authority, the Ministry of Health, and also the Ministry of Education and Childcare should also feel responsible for ensuring that these recommendations are abided by and go through. They're the ones that hold the purse strings. If these are recommendations that are coming out provincially, then I believe that the government should actually be funding and making sure that our schools have clean air. We look at schools, for instance, in Vancouver, many of them are very old. They are not earthquake safe. The insulation in these schools are poor, and some of the windows are very hard to open. And we know that fresh air should come from outdoors, right? But we live in a climate where it gets really cold in the winter, right? And so again, working with everybody working together to say, you know what, this is how we mitigate some of this, right? We can't prevent because it's here, but we certainly can mitigate and try to lessen the impact of transmission, all these airborne transmissible diseases. So I would also suggest that PACs if they're interested, or the DPAC should actually come and speak at board meetings. Every month we have what's called a public delegation meeting, and I would encourage groups to actually sign up and come and present. You have up to 5 minutes to present, but I think that the more people that present and raise this issue and make the public aware, again, it's about awareness raising. And the news always is going on about, like how we're not, like it's like it has been, and it really isn't, because we know that the data suggests that yes, infections are rising, schools back in, kids are and staff are in enclosed environments, and cold and flu and COVID and all those other things are going to come back with a vengeance. And we need to, again, come up with a strategy and a plan so we're not having a lot of absences at school, because absences also impact learning. We know that. And absences from employees impacts the quality of education as well. So it's in our best interest to work together.
Those are really very helpful recommendations, Susie. Thank you very much. Now, previous to these new recommendations from Vancouver Coastal Health and Fraser Health, parent groups were told by school administrators that school boards did not allow parents to donate HEPA filters because of the issues of equity. What do you think about this issue of donation of HEPA filters?
Well, I don't understand what the whole issue of equity means, because if we want to look at schools that cannot afford to have donations, or if parents can't buy them, or if the school can't buy them or whatnot, then there should be a plan and a strategy to say, you know what, let's pool our resources, right? And let's share. Because I don't think one school group of parents would say, oh, we've got the money, we can buy this, and too bad for that school down the road or across the city. I think that it's a community response that has to be, and I believe that equity, you provide equity by sharing and identifying which schools or which areas need more, and you act accordingly.
That's fantastic. I know, Susie, you have made a statement on clean air, and we have that. We put it out as part of our presser, and we also have it on our Protect Our Province BC website for people to read. So I really thank you for everything that you're doing to help with this. Now, one thing I do want to ask you, so what actions will you be taking to get this implemented?
Well, now that I've made this podcast, it's shareable, so I will try to share that on my Facebook, my trustee Facebook page, and hopefully people will look at that and listen to this podcast. I hope to talk, when I return to meetings in the next week, I hope to talk to fellow trustees to see if they've heard about these new recommendations and to find out how they feel about them, and maybe talk to some of the more like-minded ones to see if we can move ahead and make some of this happen.
That's wonderful. Thank you so much, Susie, for doing that. Now, going back to Jacqueline and Luke, what can parents do to ensure that the clean air in school recommendations, such as installing MERV 13 filters, HEPA filters, and CO2 monitors, among other measures, is being implemented?
Before I get into sort of my answer on that, I just wanted to bring up the equity part of things, just to they're using equity to keep everybody at risk. They're using equity as the excuse. So your school can't be safer because a school on the east side can't be safer or whatever. So they're using equity effectively to penalize all children instead of bringing everyone up. So like Susie was saying, we should be using equity to actually make everyone safe instead of using it as a tool to make everyone unsafe. And so to that end, though, and this is an argument that we've come up against often, it's brick wall after brick wall. Like Luke said earlier, we've been trying for the entirety of the pandemic just to get HEPA filters into classrooms or Corsi Rosenthal boxes. I've offered to run workshops with the students in our school, like STEM type workshops, to teach them how to build the Corsi boxes and why they're effective. And from school admin all the way up to the district, they're really rigid in their thinking. It's no, and it's often no because of the VCH guidance not allowing it prior. My hope is that the new guidance could be used as a tool to actually push them to be less rigid in their thinking and to allow for that to happen. It's early in the year, but we'll see what happens. I plan on approaching RPAC about it at least. But I actually don't anticipate the advocacy is going to be any easier because it's kind of like a group thing, right? Like they're all given their directions and they have to follow them, and very few people are willing to wiggle within that space. Anyway, even though I don't anticipate it to be easier, I think we should just not relent. I think we just have to keep pushing for it because we'll get there eventually. It's going to take a while, I think. So
I totally agree. Thanks very much, Jacqueline. And what about you, Luke? What do you think about getting these measures?
I'm going to echo what Jacqueline and Susie said about equity. It's constantly being used to as an excuse to do nothing. So first, I'd like to say that the ministry, the government, policymakers, they need to step up and they can create that equity. Already, schools are not equitable. We've seen some schools are just doing better than others in all sorts of ways, depending on what district they're in, what community they're in. Using equity as an excuse to do nothing is terrible. It's the opposite of equity. But what we'd love to see we'd love to see more parents join our working group. We're always happy to see new faces. We can give Susan the link to our website. Parents can ask their schools about clean air, ask them if their schools follow these new guidelines from the VCH, from the ministry, and are following ASHRAE 241 standards. Parents who have the expertise who have HVAC expertise, who are engineers, who understand these things, can get involved in their own school and lead some of these projects, and become part of this community that we're building. You don't have to do this alone. We have such a small group right now, and we're managing to do a surprising amount. I will say something that my colleague at Do No Harm said to me today when we were chatting about other stuff, like just the way that systemically things are so falling apart. She said, even when I don't feel hopeful, it's something I still do. Just like even when I don't feel rosy with love, I can still put work into relationships. And that really resonated with me. And the way that she says that to me, hope is an active thing, not just a feeling. Which sounds super corny, but she meant it. And it really resonated with me. It's not just a feeling. It's something that allows you to drive active change. Like I said, DPAC is going to be part of the Clean Air Festival coming up Sunday, September 15th. I'm plugging it at Slocan Park in Vancouver from 1 to 6 p.m. There'll be a ton of stuff there. It's all focused on clean air. It's mask mandatory. There will be masks to choose from. There'll be CR box building demonstrations. And we're going to have our little comic book that I was telling you about clean air in schools, which will be the first of several little pocket-sized info printouts that are aimed at not just kids, but at parents and school administrators as well. Anybody, this is very Clean Air 101. It's the basics of what you can do, and you can apply it everywhere, not just in schools.
Thanks so much, Luke, for everything that you're doing and everything that the Van DPAC is doing. That's wonderful work. Clean air is a vital issue. Not only is clean air crucial to preventing respiratory infections with airborne viruses like COVID, but is also key when it comes to protecting against the dangers from wildfire smoke and pollution. We need no other reminder of this than this past summer when wildfires devastating the historic town of Jasper. Climate change and the COVID-19 pandemic are ongoing realities for the foreseeable future. The new VCH Fraser Health Clean Air in Schools recommendations, if fully implemented, gives us hope for safer schools, a breath of much-needed fresh air. At the beginning of the pandemic, there was a feeling that we were all in this together. Do you remember the banging of the pots and pans for healthcare workers at 7 p.m.? Wearing a mask and isolating when you're sick is just not about protecting yourself, but to protect others around you. To get out of the COVID-19 pandemic, we need to get back to caring for each other. Cleaning the air in schools is the way to care for our children and our communities now and in the future. I would like to thank Susie Ma, Luc Latulippe, and Jacqueline Farah for taking time with us to do the interview today. And I'd also like to thank Kara, our IT person, without whom this live briefing would not be possible. And I'd also like to thank our listeners for joining us today. And I would also like to invite you to the Clean Air Festival on September 15th from 1 to 6:30 p.m. at Slocan Park in Vancouver, which is being hosted by Protect Our Province BC and Do No Harm BC. Thank you very much for joining us today.
Thank you, Susan. Thank you, Susie and Jacqueline as well. Thanks for having us.
Thank you.
Now we're going to take some questions, if there's any questions. Sometimes there's a little bit of a lag. Luc, I think you're going to have lots of copies of that comic available. It sounds really fantastic.
It'll be available on our website too. We're getting it. We've already had someone step up to translate it into Chinese. So we want to be able to translate it into as many languages as possible. So if anybody out there is a translator or knows one who'd like to help us out, please do. And it'll be available, like I said, for download. It's a little, it's not quite it, but it's what it is close to looking like. It's one of these little comics that you fold up and it fits in your pocket. You print it out from any printer, and you cut it up and you fold it. And we're going to have some on clean air. We're going to have some on CO2. We're going to have some on masking and things like that.
We don't have any questions, but Jacqueline.
There are a couple of comments that I'd like to read from
Yes,
the
please
YouTube
go ahead.
feed. So one person doesn't have their name visible, but they say that clean air is an equity issue. The most vulnerable people and communities are at the highest risk from viruses, wildfire smoke, and pollution. So absolutely, it's more than just viruses, and we keep the most vulnerable people at risk when we refuse to address these things and use the tools that we have available to us, right? And then another is from Lynn. If equity was a reason to hold back clean indoor air for all BC schools, then St. George's private schools' ventilation and air filtration systems shouldn't have been allowed to be improved. And they improved their ventilation systems 4 years ago. So, yeah.
Yes, very much true. They had an engineering firm come in and do a complete analysis and rehaul of their private school. So there you go, right?
Yeah, exactly.
And so we have a question now. You've talked about how to get parents involved in pushing for clean air. How about kids?
Yeah, absolutely. That's one of the main aims of this little comic book that we're making. It's not like an engineer's guidance on how to do clean air. It's aimed mainly at kids, teachers, and their parents. Basically, like I was even testing it with family and friends who don't know anything about ventilation or HVAC, and I'm like, does this make sense when you read it? Do you get what this is? And it needs to be the most basic starting approach to clean air. The little story in it will definitely teach kids what it's about and how to do it, because it is so easy. It is not rocket science, as we all know. The basics are like open a window and plug in the air cleaners. And you can also learn how to build your own air cleaner that we know is the Corsi Rosenthal box. The science of it is so basic. It's filters and air. It's filters and a fan pulling air through. It's so easy to understand. it's not impossible. And I know that a lot of, we know some teachers have used making these in their classroom as part of their science curriculum. So there's so many ways that you can involve kids. Absolutely. We talked about having, in some classrooms, having a kid in each class who is sort of like, you have like a fire marshal in school, you'd have a clean air marshal, a kid who makes sure that the CR boxes are turned on in the morning, that the windows are open, that the CO2 monitor is at a good level. Yeah.
Those are great ideas. Can you talk a bit about the intersection of clean air and climate resilience?
Do you want to take that, Jacqueline?
I'm
I'm giving you the hard one.
No, I was going to say.
For you.
Yeah, I mean, I'm probably going to like buggle it because my brain was actually thinking about what to do about kids. So that's where my brain was before the question came up on the screen, because we've been trying to get our kids to do presentations at PAC meetings or to the district. So that just was another thing that I was going to tack onto that. And that's totally where my brain was. In terms of climate resilience, like, I mean, the issue is that much like with the pandemic, there's a lot of denial going on with regard to climate change, right? So it's kind of twofold. Like, if we're not cleaning the air while the climate continues to worsen, then the most vulnerable people are going to continue paying the price for that. But also, if we're not, working to also fight climate change, we're going to continue that same cycle, right? So again, the vulnerable people will keep paying the price for both not dealing with climate change and also not at a like granular level dealing with climate change, right? Like dealing with cleaning the air in classrooms, in hospitals, in houses. Like we have Chrissy Rosenthal boxes in our house that run, and the amount of dirt that they pick up, like people are breathing that into their lungs, right, on a daily basis. And so yeah, it's definitely, it's all interconnected when you pull back and look at it from a wider lens.
I mean, I think I can, it's not just vulnerable people. Climate is important for all of us. I was listening to a older podcast by Dr. Eric Topol, and he was interviewing physician researcher, Dr. Charlie Fontaine, and he is a lung researcher in the UK. And what the new research on some of the emerging lung cancers, like the small cell cancers that we're seeing in non-smoking people, is that it's being caused potentially by air pollutants, right? Chemical pollutants, not just mutations, but actually directly, going into the lungs and damaging the lungs to make the lungs kind of more susceptible to lung cancers. So, this is direct effects of pollution on our health, and not just vulnerable people, everybody, right?
Yeah.
And so, and we want to leave, our children with a better world, right?
Mm-hmm.
Yeah.
What you said reminds me of secondhand smoke too. I remember being, we know it took about 50 years of slowly crawling towards finally getting smoking banned from all indoor spaces. And I'm old enough at 55. I remember walking by the teacher's lounge in school, and you could smell that cigarette. That was happening. And then I remember as a kid hearing, watching the news over my parents' shoulders and hearing about secondhand smoke. And even as a kid, I thought, yeah, that makes sense, because they were interviewing like people who worked in restaurants going, I never smoked a day in my life, but I worked in this cafe and everybody smoked. And now, my health has been impacted. And as a kid, it just made sense. But there were so many people even back then pushing back, going, there's no such thing. We know that now. And it's a given, point of fact in how we talk about cigarette smoking. We have to get to that point with clean air for airborne pathogens too.
In the same podcast I was listening to with Dr. Swanton and Dr. Hopel, they're talking about the irony. So here we are, coming up with some of the biggest discoveries on how to fight cancer. We have monoclonal antibodies, all these wonderful things. And yet the environment is the one directly impacting our health. And we're the ones that are actually causing our environment to be bad, right? And so, we're seeing all these plastics now, microplastics, that are actually found in blood vessels, blocking blood vessels. And this is a factor in, heart disease, cardiac disease now. So we, in fact, are creating our own problems. Well, on the other end, we're coming up with these wonderful, new solutions to fight them. But if we did something about it in the first place and not make our environment such an issue, we wouldn't have to do the other end of things to try and fight it off, right? So
Yeah.
it's the irony of the situation. I think, I don't see any other questions coming today. I think we've answered everyone's questions. So thank you all for coming on today. Thanks again to Susie Ma, our COPE VSV school trustee, and to Jacqueline, parent extraordinaire, okay, and to Luke, who's coming from the Van D Pack. Thanks for all the work that you're doing. And thanks again for joining us on POPBC. We will have Susie Ma's statement on clean air on our site. And Luke, we hope to get a copy of your comic on our website too for viewers. And don't forget to come to the Clean Air Festival. It's on Sunday, September 15th at Slocan Park in Vancouver from 1 to 6:30 p.m. Hope to see you there.
Thank you.